Hi. So I'm going to begin with articulation disorder, and I did make a few notes. However, I did not use any of my notes that I turned in prior to my other presentation. So, articulation disorders is when a child has difficulty express or saying individual sounds for the consonants or the vowels, and therefore, when they're having difficulty saying these individual sounds, it's also due to the placement of their lips, their teeth, their tongue to their teeth, or even the tongue to the palate. And not even all this, just even the puffs of air, all that goes together in being able to accurately and effectively producing these sounds. And without that, we have a articulation disorder. Articulation disorders are actually also part of the phonetics, and this is also the single sounds that are made within words, so consonants and vowels. So therefore, a child might say the word run, and but they don't say run. They don't use the R. They might replace it with a W, and they may say one for run. So therefore, there's that articulation that's also affects the phonetics, and then there's the phonological disorder, which is a little bit more complex than the articulation. And that's where they have the difficulty of producing where it's more than one sound. And phonological disorders, they affect the phonemics of the phonological disorder. I'm sorry, I got hair from the fan blowing on me. And students, they also have difficulty organizing their speech. Like they're having a hard time getting all the sounds together, and if there's more than one sound, they got to get it all right in their head, and then they have to like get it out of their mouth. So therefore, that's a little bit more difficult for them to try to produce these sounds. My daughter, when she was little and 2 years old, she started having some difficulty, and around the age 3, we decided we need to be, investigating a little bit more, and I just couldn't understand what she said, and ended up being that she did qualify for speech services. She had an articulation disorder, and she kept trying to tell me about a squall. I didn't know what she was saying, and one day a squirrel ran across the power line, and she yelled out a squall, and then I realized what she was trying to tell me. But she definitely struggled really hard with her R's. Her name is Carly, and she referred to herself as Collie. So people would always have a hard time understanding what she was, trying to say. And the implications that these children can experience, especially with articulation. For one, people understanding what they're trying to say, that makes it difficult. And this also can affect their learning, their spelling, and their reading, even their socialization skills, because let's face it, some kids can be just cruel, and not to mention they build up a complex and they kind of get embarrassed themselves. And the implications that phonological disorders, it's basically difficulty reading words fluently, being able to read a passage, and because you're having to work out those sounds in your head and get them out, it slows you down. It makes you read at a much slower pace. So therefore, with that happening, that often will create problems with comprehension. So all these things definitely are super important. I do work with my speech teacher at work. I'm a special ed teacher, so therefore I'm trying to help these students as well to perform and say things accurately, because I want them to be, to succeed as well and with their speech and their language. So, but with that, thank you and have a good evening.